Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and that's all I do is perform cosmetic or aesthetic plastic surgery. I perform a lot of Brazilian butt lifts, and basically people want to know when they come in what it is how the procedure is performed, where I take fat from, what the reabsorption rate is, and also what happens in the long term to the fat with regards to exercise and diet. To understand what a Brazilian butt lift is, basically I'm taking fat from one area of your body, generally the abdomen and the flanks and low back. I'm purifying that fat and I'm re-injecting into the buttocks. That fat goes beneath the gluteus maximus muscle, into the gluteus maximus muscle, and above the muscle into the soft tissue of the buttocks. That fat should be stable after about 3 weeks or so. So I'm looking for that fat not to be a filler, but a transplant. I'm looking for that fat to gain its own blood supply, so it's a living implant, if you will. There are things that can affect that fat survival. So of course, how I handle that fat when I take it, I want it to be very gentle. I want to treat that fat in a very gentle fashion when I re-inject it. And then post-operatively, I try to minimize any activity for the first 3 weeks or so to allow that fat to get stable blood supply. Long-term, after around 3 weeks or so, as people start to accommodate themselves back into their normal routine with regards to diet and exercise, a common question is, what happens if I lose weight? How will that fat be affected? And the bottom line is, as long as you stay within 10, 15 pounds of what your normal body weight is in terms of where that weight was at the time of the fat transfer, you should be okay. Of course, that if you lose a lot of weight, you'll see some of that fat transfer diminish, but it will proportionally diminish. It's not like all of a sudden that fat is going to go away if you lose weight, and the rest of the areas of your body will stay the same. So it's going to be a long-term increased proportion to your buttocks because we're taking fat from one area, put it into another. But again, if you lose a lot of weight, you'll diminish fat stores everywhere. So the bottom line is you want to maintain that weight through a healthy diet and exercise and not deviate from your basic plan for about 10 or 15 pounds. There's a lot of nutritional counseling that we do. We try to have you stay away from exercises that can increase the fat degradation. So the best way to get an idea about how to approach your Brazilian butt lift and how to take care of it post-operatively is to come in for a consultation. We'll educate you about what the procedure is and hopefully go from there. Thank you very much.